morning. My name is Sarah. I was not planning on doing an actual video. This is extremely far away from my comfort zone. I don't really like to even be in pictures, but I really enjoyed watching everyone else's video and kind of getting to put a name with a face of people that I've been posting in discussion boards with for not just this class, but multiple before. So you kind of inspired me to do this instead of a PowerPoint. So thank you for that. Obviously in this video, I'm going to be reviewing my personal philosophy on nursing, which has been shaped by my past education and exposure to nursing theorists and ethics and, the nursing code of ethics that we've all read once or twice, and also my career thus far in skilled nursing, acute nursing, bedside nursing, and now care management, which has led me to have some different views and opinions and insights into kind of what I view overall as my nursing philosophy. So first and foremost, I think we as nurses and all healthcare providers have a responsibility to provide care to our patients regardless of their background, what they've done, what their living situation may be like, what their personal views are, politics, whatever. I think all of that is set aside when it comes to providing care. And we have a duty to kind of leave our personal thoughts at the door, so to speak, when we enter work. So personal story, I live in a fairly small town in North Idaho, and my husband is involved in public service. So I kind of have a heartstring for those type of people. In the past few months and years, we've had a couple officer-involved shootings, and when I worked bedside nursing, I actually was assigned to take care of the shooter for one of these where we had a officer-involved shooting and the officer had actually died. So it was fairly obvious to me that I had a personal struggle with that, and I really had to be cognizant about how I felt about this patient because of what he had done, and kind of check that out the door and remind myself multiple times actually throughout the shift that he was a patient regardless of what he had done or my thoughts on what he had done, and that I needed to provide the same care to him as I would to anyone else. Compassionate care and safe care, and also to be his advocate for things that he needed. So in my most recent experience, the past couple of years have been spent being a care manager, and that has led me to have a little bit different insight into the nursing world. So I do kind of like the discharge planning and overall care coordination for patients in the critical care arena. And we get a lot of, quote, self-pay patients through that have had some life-altering event and will require long-term care or significant rehab before they can return to their new normal life at home. They may not ever fully recover. So I have kind of gotten to see the side of nursing that involves the financial portion and the barriers that are in place with both commercial insurance and then not having insurance or ability to pay for care. So that has influenced my thoughts, diving into politics just a tiny bit, on universal health care and access to health care for all. And I feel strongly that as nurses and advocates for patients and providing the same care to all people, we should be pushing for and advocating for a universal system that patients have access to affordable care that doesn't limit them and kind of play God, so to speak, of what they can have when it comes to healthcare. So I think our current system has a lot of limitations in place, even for those that have insurance. I also think as nurses we have a responsibility to remain up to date and educated on best practice to provide safe and quality care to our patients. So as nurses, we're lifelong learners, and there's always updates and changes to how to do things, not just because we've always done them a certain way, but because we know them based on evidence to be the best way to do them. So I think in order to provide quality care to our patients, we have to remain always learning and always searching for better ways to do things, the safest way to do things. And I think that goes along with holding each other accountable. So it's more effective than a policy to arbitrarily be in place to hold your coworker accountable and have them hold you accountable too, even if it's something as simple as hand washing. So I think that goes a long way, and that we as nurses should be doing that every day when we go to work to hold each other accountable. I also, probably one of my biggest roles currently, and I think every nurse has the same role in some fashion, is to be a patient advocate. So oftentimes we are the ones with the patients on a more personal level. Maybe we spend 12 hours a day with them, doing very personal care items or really just listening to their concerns. And we become the advocate for the patient to voice their concerns or opinions or wishes to other members of the healthcare team, possibly physicians, and making sure that our patients have what they need to be knowledgeable and understandable and understand their diseases or healthcare conditions. So I think those are probably the top 3 things that I kind of have a strong, passionate opinion about and feel that would incorporate into my personal nursing philosophy. And I'm over my time, so thank you for watching. Thank you for watching me be out of my comfort zone. I hope this helps put a name with a face when you're posting. That's kind of what it's done for me. Thanks.